The news from Pfizer is early good news that we're in direction and that there is evidence of, with 2 doses of positive news. But the reality is that's just 10 to 20 million doses maximum by the end of the year. And there will be a ramp up after that, but it is going to be some time before we get the kind of widespread availability of multiple vaccines with a secure supply chain that gets everyone the 2 doses they need to actually start to achieve even partial herd immunity, forget full herd immunity. And so if you're thinking about when does life get back to normal, it will require a multiple pronged strategy. In the short term, meaning in the next 6 months to a year, we cannot hang our hat solely on vaccines. It will be everything else in addition to vaccines protecting essential workers, the vulnerable elderly in nursing homes and others. But the vaccines will ultimately get us out of this, I think, in 2022.
First, the Pfizer data, we haven't seen much data. It's a press release, but we've looked at previous phase 1, phase 2 data from Pfizer, and I have to say this was a surprise. I was expecting, even last week, I was speaking at a conference and saying that we will be lucky if the vaccine is 60 to 70% effective. A 90% efficacy was not what I was expecting. And boy, am I happy to be wrong in that direction on that. So, but it also had a couple of other effects. So while that is true for the Pfizer vaccine, and again, we'll have to see the data and see what it looks like. The second part is that it makes me more optimistic about other vaccines, including Moderna, which is a very similar vaccine construct, but even the other ones that target the spike protein. So I've become more bullish about vaccines in terms of their scientific, in terms of their impact from a science point of view. There are some enormous challenges for the Biden administration in terms of this vaccine. So as Nirav said, first of all, we're gonna have to ramp up production. Production is important. A lot of these vaccines have to be stored frozen and transported frozen. There's a huge logistical supply chain set of challenges there in just getting the vaccines out into the community. You know, the old line of vaccines don't save lives, vaccinations do. There's a huge challenge from a supply chain perspective of getting the vaccines out. And then last but certainly not least, and maybe even the most important at this point, is that there's a huge challenge around vaccine hesitancy and around engaging people, especially in communities of color, but other places as well, to help people understand why they should get vaccinated. We're not going to have mandatory vaccines by and large, and we're going to have to really engage with people, understand where their distrust comes from, engage with that, engage community and civil leaders and religious leaders. This is going to be a all hands on deck to work with people to get a high level of vaccination. If we don't do that hard work, by the way, and we just put it out there, 30–40% of Americans will get vaccinated, and that will not be enough to bring the pandemic under control. So a lot of hard work ahead for the Biden team, for states, for public health leaders, for all of us, for journalists, in really clearly communicating to the American people what the benefits and challenges of the vaccine are. Communities of color have been really hit hard in this pandemic. There has been, one of the things that I think has been a bright spot has been that the companies doing the trials have been really focused on making sure that they have a diverse set of volunteers. So we're not just testing it in 18 to 30-year-old white men and women, but in fact, we're testing it in a broad swath of America. I think that is happening, and not perfect, but happening. Part of the reason the Moderna trial got delayed was actually to do a better job on diversifying their recruits. If we finish with that, and then we really go out and engage with communities, try to make sure that we prioritize high-risk people who often are people of color, I think we can do this. But what I worry about is a lack of a deliberate effort and just hoping that it'll just naturally happen. And we all know what happens when we don't make a deliberate and proactive effort. It doesn't end up working out well.
Just that we have been extremely creative in our vaccine development, for example. That creativity is across the spectrum. There have been creative approaches to exposure notification, to contact tracing, to engaging with communities, to resulting tests of COVID by text messages, for example, from a company named Healthvana. So we can reach people. We know how to do it. We've been thoughtful about it. We just need to do it in a more structured and standardized way. as opposed to the 1,000 points of light approach, where every state, every city is doing something on their own. Simple coordination using evidence-based approaches will make a big difference here.
We're likely to have two vaccines fairly quickly, the Pfizer vaccine and the Moderna vaccine. And the Pfizer vaccine, of course, through a news release, we haven't seen all the data, says that it's over 90% effective, which is stunning. That's more than most of us believed. Now, let's assume for the moment that all the safety issues are fine and we get an emergency use authorization. At least in this country, then, we will distribute this vaccine in a prioritized fashion. First, to healthcare providers who care for patients with COVID in hospitals, in nursing homes, and emergency first responders. And then subsequently to high-risk people, essential workers, and the rest of the population. This will all take a great deal of time. Now, the distribution is complicated by the fact that these vaccines are very fragile. They have to be kept very cold. And in particular, the Pfizer vaccine has to be kept at minus 80 degrees centigrade through its shipping and in its handling. They have worked out methods to do this, but still, this means this vaccine can only be given at distinctive locations where the personnel are very well trained to do this. This is not a vaccine that will be available at the local pharmacy or in a physician's office. But in the beginning, at least, that's okay, because most of the people who will be receiving it initially will be healthcare workers, many of them in hospitals. So nonetheless, organizing that is difficult. For example, in my own state, how do we get this vaccine out to rural areas, in smaller hospitals and in smaller nursing homes? We're going to do it with trucks, and we're going to have teams circuit ride to go out and do that. And then there's an additional complication, because these are what we call reactogenic vaccines. They hurt, and they may make your arm very sore for several days, can give you a fever, can give you aches and pains. You're not feeling entirely well. You might even get a degree of fever or a headache. That's your immune system working to start with the vaccine to develop your protection. You're not getting COVID. You can't get COVID from the vaccine. Please don't even think about that. But that does mean if you go to a small nursing home somewhere, you may not want to vaccinate all your people on the same day, because the next day and the day after, some of those people may not be able to come into work. So we're going to have to do this in phases, which will make all the logistics even more complicated. So more to come about all of that, sir.